Hi everyone. So today we're gonna learn about NTG infusion. NTG, it is a nitroglycerin, which is an potent vasodilator. Mainly, it decreases the preload, and thus we can achieve, blood pressure reduction. And it can also be used in various conditions, like it can be used in acute coronary syndrome, pulmonary edema, heart failure with high BP, and resistant hypertension. All these conditions we can use NTG. So before going for any antihypertensive drugs, we should always rule out CNS symptoms. We should rule out CNS conditions where we should not touch the blood pressure. At least we should not reduce the blood pressure more than the target blood pressure. So after ruling out all the CNS symptoms, we can go for reduction of blood pressure. Coming to NTG infusion, in NTG infusion, we should memorize this. The starting dose is 5 mcg per minute, and the effective dose can be modified from 10 to 200 mcg per minute. All these calculations are in mcg, mics, not in milligrams. It is in micrograms. We should aware of that. And to calculate that, we have this formula. What is this formula? We have rate is equal to required dose divided by prepared concentration into 60, and through this calculation we can get the rate which we have to installed in that infusion pump or any machine or the drops. If we don't have any infusion pump, we have to calculate the drops. For that also we have to know the rate for an hour, and the required dose is what we are adjusting it. It can be 5 mcg or it can be 10 or 200. It depends upon the physician, and the prepared concentration is also depends upon the physician. We can prepare the preparation of the NTG with NS. We can prepare in various combinations. For example, I took one example for you guys. In this example, we are taking, like we know, in infusion pumps we can install a 20 ml syringe or 50 ml syringe depending upon the infusion pump. So the preparation should be in 20 ml of solution. So we are taking 19 ml of NS. In 19 ml of ml NS, we are using 1 ml of NTG. And we should be aware of that 1 ml of NTG contains 5 mg, milligram, not mics, which we are calculating in all these steps. It is in milligram. So in 19 ml NS with 1 ml of NTG, we get the 20 ml of preparation, which has 5 mg of NTG. So the prepared concentration, we should do the calculation maths we should do. In 20 ml preparation we are having 5 mg NTG now, and in 1 ml how much we will get? 5 divided by 20. Just we are going to do that, and 5 divided by 20 we get 0.25 mg per ml. It is an mg, still in mg, but for in every concentration and in every calculation we have an mcg. So we will convert it by multiplying into 1000, because we know 1000 mics is equal to 1 milligram, and by multiplying that we will arrive the prepared concentration dose we will be getting. If we are preparing a 19 ml learners with 1 ml of NTG, we will be having 250 mcg per ml, and we should apply this in the formula. So how much we are taking? We are taking 5 mcg as the initial dose. So 5 mcg we are putting in that formula. And what's the prepared concentration? 250 mcg. Multiply by 60, because we have to calculate in an hour calculation. It should be in slow infusion, which will help in various conditions. STEMI, acute coronary syndrome, pulmonary edema, any hypertensive emergency. In all those conditions, we're going to use this NTG infusion for that condition. So we are arriving 1.2 ml per hour. So this through these steps only we arrive this rate. So we will calculate this rate and we will put or install this rate in our infusion pump, and we will start the infusion for the patient. Coming to NTG preparation and dosage, we have various dosage. If you know these NTG preparations and dosage by heart now, we will use these calculation in a second during emergency conditions. So as of now, we will be knowing there will be 20 ml syringe. There will be 20 ml syringe which can be installed in the infusion pump. For that, like we will see the calculation. In 20 ml syringe, we will be preparing 19 ml NS, and with 1 ml of NTG, we will arrive 1.2 ml per hour as the rate. If we setting the required dose as 5 mcg and the concentration we will get is 250 mcg per ml. Similarly, same preparation 19 ml NS for 1 ml of NTG. If we raise the required dose to 10 mcg, we will arrive the rate as 2.4 ml. Similar same conditions, and if we are increase the rate, I mean required dose or the initial dose has 15 mcg mics, we will arrive by 3.6 ml per hour as the rate. So why we need to know these increasing rates? Because in this condition we can't giving the same rate throughout the course. We have to increase it. If the required bp is not reducing, we mostly took sbp as a target thing, that is systolic blood pressure. If the systolic blood pressure is not reducing even after 10 minutes of the infusion, we should raise the rate. In first 10 minutes the SBP is not reducing, we have to increase the dose. So like we have to titrate the infusion concentration according to our SBP. So at the initial phase we will have 1.2 ml per hour. We will monitor everything vitals, we have to monitor while administering infusion to the patient. After 10 minutes of the infusion still the SBP is not reducing, we have to go for 2.4 ml, that is 10 mics. We are raising. At initial we have giving 5 mics per minute as the NTG infusion, and we are raising to 10 mics. 10 mics na it will come to 2.4 ml per hour, and later we will have 15 mics. So for every 10 minutes we are raising 5 mics of NTG infusion. That's it for 20 ml. There are some other preparation we can use various preparation depending upon the institution or whatever the protocol that is followed in each hospital or institution. So some other example, we can use 15 ml and NS with 5 ml and TG, because there are some preparation or vials we will get that is of 5 ml itself. We don't have to waste the rest 4 ml if you are only have to use 1 ml in our preparation. So we can go for 5 ml of NTG and the entire bottle, and we will mix it with 15 ml NS, and the required dose we can adjust to 10 mics, and we will get zero point 0.5 ml per hour. Rest the same with different concentration and dosing. Coming to contraindication, there are some contraindication we have to that should be in our mind before starting an infusion. If the patient, and the obvious one is hypotension. If the patient is already in hypotension, but he or she, the patient is having some cardiac condition, we should not lower the blood pressure. And we should always have to remember that NTG will reduce the preload, and in R we write ventricular MI, we should not touch the preload. So in those conditions we should not do NTG infusion. And mainly in PTE 5 inhibitor like sildenafil, tadalafil, some patient will be on sildenafil for for their erectile dysfunction. We should take a proper history before giving any drugs before we have to do a proper history taking. And one of the drug interaction it should be in our mind is PDE5 inhibitor. Another one is severe aortic stenosis, severe anemia. In anemia and all, the hemoglobin will be converted into methemoglobin when the patient is on NTG. So we should be that should be in mind. And there are other related contraindication also, which you should read. Thank you. That's it.